Hello and welcome to the second webinar of the annual general meeting for Frontline Wellness United. In this next webinar, we're going to be talking to Colleen Dempsey and myself, Lisha Sterling, about thinking beyond HIPAA compliance. Colleen's going to be talking about HIPAA compliance, and social work and health, and what you need to think about when taking care of protecting your clients' safety and privacy. And then when we move into my portion of the talk, I'm going to be scaring you with all of the ways that companies and potentially governments are listening in on all of your conversations, and give you some more things to think about that go beyond just plain HIPAA compliance. To get us started, I'm going to pass over to Colleen. And while she's talking, I'm going to be setting up the questions and answers. If you're watching us live on YouTube today on Sunday, September the 16th, 1 p.m. Pacific time, 4 p.m. Eastern time, then please give us some questions. You can either do that in the chat that's in the upper right-hand corner of the YouTube channel, or in a few minutes, I'm going to be posting a Google spreadsheet Q&A link, and you can then use that link to that we can answer in the middle of the webinar. So without further ado, let me move on.
Did you pass it to me, Lisha? I kind of lost you there at the end. Am I good to go? Cool. Okay. I'll go ahead and start and hope that this is coming through to folks on the other end of wherever. Thank you so much for having me, Frontline Wellness. I'm really excited to support this project and the mission of the organization. As Lisha said, my name's Colleen Dempsey. I'm the practice associate with the Ohio chapter of the National Association of Social Workers. And I'm going to start with a big fat disclaimer. Lisha really did a good job of summarizing what I'll be talking about today. I just want to tell you who I'm not before I can tell you who I am, and then tell you some more information. So certainly I'm not a lawyer, which means I couldn't be your personal lawyer. And a lot of what we're going to be talking about today hints at, or kind of will discuss, some policies that absolutely impact practice for social workers, for healthcare providers broadly. And I'm hoping to initiate critical thinking and more questions, but really any kind of practice that you're doing should be reviewed and kind of thought of specifically by someone from maybe a legal perspective, certainly from your own, your individual perspective based on the state you're in, things like that. And I also come from a pretty, well, certainly a strong social work perspective, a social work lens. I'm going to be talking about the NASW Code of Ethics some today, talking about laws and rules as they impact social workers or other mental health providers. I think a lot of it is applicable to kind of the medical surgical side of healthcare, but my expectation is that anyone listening to this is a a professional and can take this information and then apply it using their own professional discretion and judgment. And I hope that it can be helpful in that way. All right. But my role with the National Association of Social Workers is practice associate. So I do spend lots of my work time supporting social workers here in Ohio in their efforts to be ethical and compliant social workers. Social work, of course, is a super broad field, so not just mental health providers, but also folks who work in child welfare and hospital settings, healthcare, various different kind of areas that might put them in touch with HIPAA or not. So I say that just to kind of contextualize my frame of reference, which might leave some things out. So take that as it comes. I do recommend, wherever you're listening from, whether it's a different state or a different profession, different frame of reference, that you maybe be in touch with your professional association as the advocate for you and the resource to help you sort through practice and ethical questions. Certainly social workers in Ohio are welcome to reach out to me at NASW. All right, so we'll talk a little bit more about the context. So we use HIPAA as a frame of reference today. I was asked to talk kind of about HIPAA. I think that when we refer to HIPAA, we're often actually thinking of something a bit broader than that, but it has kind of become a shorthand for all of the rules and policies that would impact our practice and the way that we manage confidentiality and the privacy for our clients. So I want to kind of be clear about that, and there's a few different angles to consider when we're talking about this thing that we'll call HIPAA, or kind of privacy policy. So HIPAA is a federal law. We'll go into the timeline a little bit in a second. Anyone practicing in the United States and in other countries will also have, perhaps more local policies, laws, rules that would govern practice. So I'm in Ohio, I'm a social worker here. I would look not just to HIPAA for guidance on managing health records and maintaining privacy, but also to my state revised code and administrative code. I might find that through my licensing board, or it might be something that's not directly under the jurisdiction of my licensing board. So you see this gets big quickly. And then I think there's a third perspective that's really useful to understand our responsibility toward our clients, and that's our ethical code. So our hope is that these three things, federal law, state law, and a code of ethics, would build on each other and support each other, perhaps giving kind of specific prescriptive guidance or good kind of reasoning behind our practices. But sometimes they might also put us in a position where we feel a sense of conflict. So maybe we can get to some of those that I've experienced or worked with folks to consider before as well. Okay. So HIPAA, quick background, just to make sure that everyone is getting the same information. I imagine this isn't new to some of you. 1996, Congress passed the Health Insurance Portability and Accountability Act. We call HIPAA. And since then, we've built on this. This was a law that was passed and developed enforcement mechanisms and become more specific as technology has advanced. And we've learned more about what the expectation should be. So in 2003 and then 2005, 2 rules related to HIPAA became enforceable. The first was the privacy rule in 2003. So this was a rule established through the executive branch through Health and Human Services, Department of Health and Human Services. And then 2 years later, the security rule came down. Both of these rules started to establish standards that we would follow nationally. so that there was some level of standardized expectation throughout the country. Like I said, different states likely had rules that preceded HIPAA and were already kind of governing practice and privacy standards before that. In 2009, we had another law passed through Congress, the High-Tech Law, Health Information Technology for Economic and Clinical Health Act. Basically, this gave our former policies related to HIPAA a little bit more teeth. So now there's sanctions, financial sanctions for falling out of compliance and being caught being out of compliance. So that was in 2009. And then in 2013, we have the most recent big act around HIPAA, and that's the omnibus rule. So it kind of pulls everything together, more formalizes the enforcement and sanctions specifically. Some things that HIPAA does and doesn't do. So HIPAA is really concerned with the electronic transmission of health information. And so actually, one thing that you definitely want to do as you're pursuing work, particularly work that might be scrutinized or might be at risk of kind of someone requesting records and or extra scrutiny from wherever that's coming from, is to make sure that you're very clear on whether or not you're a covered entity under HIPAA. HIPAA covers three broad kind of sections. It covers providers, healthcare providers like me, social worker or a doctor or a nurse. It covers clearinghouses, and it covers health plans. So beyond the providers, it really covers kind of billing and like logistics around healthcare as well. But we're going to talk specifically from a provider frame of reference today. If you work for a health insurance company, this might be relevant, but hopefully you're getting other kinds of trainings as well. So you want to know if you're a covered entity, and Health and Human Services does have a really simple tool that might be worth checking out. Basically, there's two questions to find out whether you're a covered entity, and then it shoots out an answer for you. The questions are regarding, are you a provider who furnishes, bills, or receives payment for healthcare in the normal course of business? And if so, are you also someone who transmits any covered transactions electronically? And if so, you're likely a covered entity under HIPAA. And so I say that just to clarify that there are methods of providing healthcare in theory that would exempt someone from the HIPAA standards. And I think it's good practice to essentially follow and assume that you are required to be in compliance with HIPAA. For the most part, that lines up with any state regulations as well. And it's, for the most part, also really good ethical practice. Because if you're you've checked all the boxes and you're definitely exempt from coverage under HIPAA or kind of compliance requirements under HIPAA, you still are required to, at least in Ohio, have a good informed consent policy. And we're going to get to informed consent a little bit later. So you want to know if you're a covered entity. Some things that HIPAA covers. It's pretty prescriptive in what the provider is supposed to have in place. So this would require you to have a risk management process for assessing your risks of security breaches, releasing personal health information without unintentionally. You're required to have a procedure in place for those notifications if you do release information without the proper procedure in place or without authorization from the patient or client. You're required to have some patient rights information, ways that you're expected to disclose that to your patients. process for complaints if your patient thinks that you have not followed these rules, and basically a point person to go to. And HIPAA puts in place the enforcement mechanisms for noncompliance, and basically just kind of dictate some of your policies and procedures. If you've worked in an agency setting or a larger practice, likely you've had a whole department or at least a person that's in charge of just managing all of this work. So many healthcare providers, at least in their first jobs, don't really have to interact with their the HIPAA requirements because those are being managed by a department or the compliance folks at the agency. If you're in private practice or certainly doing any volunteer work, you're going to have a bunch of information that that might be really new to you, and hopefully you've already been doing because you've worked in an agency setting that the agency, you know, checked all their boxes, but you don't want to assume that, and it is a big learning curve. HIPAA compliance is it's a thick set of policies, and I say in my experience working with social workers, most folks haven't really dug in the way that we're expected to into kind of understanding what this all means, what it means to be compliant with HIPAA fully. So really, there's a level of risk that we're all taking on by not having read thoroughly through all of the materials. I would recommend that everybody take some time at the Health and Human Services website. They've got lots of tools. Their FAQs are pretty thorough, but also readable. It's really worth your time to spend some time there. All right. Okay, so I want to talk a bit about informed consent. I know we've... Someone saying something? Or is that my echo?
I think it's your echo, sorry.
Okay, cool. I don't know why it just started. Okay, so regardless of whether you're covered by HIPAA, you should take responsibility today for developing a really thorough informed consent process that would comply with HIPAA and with your state laws and rules. The responsibility, it's very clear in our in NASW's Code of Ethics and in anything that's codified that I've seen, that the responsibility is on the provider for ensuring that the person that you're seeing has consented in a way that they are actively consenting. So I think lots of us who have done this work sometimes get a little lazy with the process of informed consent. It can feel like a big long spiel to talk to people not only about kind of, you know, what services you're going to provide, the risks, inherent risks of those services, the benefits, the who you are, your methodology, you know, limits to the privacy and confidentiality, how they would go through a complaint process, et cetera, particularly in therapy settings when you are you know, seeing somebody who might have something that's really on their chest that they just want to get out. So I really encourage everybody to think of informed consent as an active and ongoing process. There's some things we really just need to make sure our patients or clients understand early on, and that's protective of us as providers in attempting to stay in compliance with HIPAA, and it's also protective and ethical for folks that we work with. And I'd say just the level of kind of need to be really on point with your informed consent process for the people like activists, people on the front line that you might work with through this organization is just all the more, all that much more stringent, and we should really be taking it seriously. All right, so I want to talk a little bit about like what all goes into active and proactive informed consent, much of which is covered by the requirements of HIPAA. So you see where this lines up. So we want to, as I sped through before, I'll just slow it down a little bit. In any informed consent processes, you want to talk about the risks of the services that you're providing. So for a mental health service, regardless of your delivery method. You want to talk about kind of the types of feelings that might come up in therapy, your models for therapy, your methodology, things like that. And if you're delivering services online or going to be using technology in any of your services, you'll probably want to have a spiel about encryption, the way you've used encryption, the kind of ways that you are able to communicate with somebody, and the inherent risks of all of those things. So when I talk to new clients, I talk about kind of texting or voicemail and email and the differences of risk level in communicating those things. I'll tell them, hey, if you are having a crisis, texting might not be the best way. It's not the safest way. If you just need to tell me you're running 10 minutes late, that might be a better option for you. And if you're providing any kind of, teletherapy, this becomes all the more necessary. In any kind of informed consent process, you want to cover payment and what your expectation is for payment, and make sure you're clear with the client about that. You want to cover confidentiality, limits to confidentiality, and access to records. So patients, clients should have pretty much full access to their records. It's, in Ohio, at the very least, it's a pretty extreme circumstance that you'd have to document harm to them from not offering their records back to them upon their request. And of course, there are also limits to confidentiality, and that you really need to explain upfront before your client has told you anything, because you don't know what's going to come out of their mouth. And to tell them after they've told you something that you have to report, say, to Child Protective Services, really diminishes that patient-therapist relationship. So you want to talk about your understanding of the limits to confidentiality and how you go about working with your patient in disclosing their protected health information if they are, if you feel that needs to be disclosed to an outside party. So what I always say, the very basic spiel is that anything that happens within that relationship, within the therapy office, stays between us. And that's true if this person is a minor, if the person is an adult. But of course, there's more context if they're a minor. You want to talk about the limits being kind of generally around harm. So I usually talk to my clients about if somebody is, excuse me, at risk of being harmed, and that might be, or currently being harmed, a child abuse situation, an elder abuse, another vulnerable population, or risk of self-harm, or committing violence against another person. Those are things I need to take action on. I try to get through those pretty quickly, but then revisit them throughout the course of treatment, because they may or may not be more relevant based on what someone is seeing you for. And I try to tell at least my clients that my process for handling something, if they have disclosed something to me that I feel like I need to disclose outward. So I'd really encourage everyone to have a solid spiel, to really be able to deliver an informed consent initial speech confidently and quickly, but also ensure that your patient understands what they're getting into and working with you. So again, if you're working as a volunteer, if you're working electronically, if you're working with someone who is being kind of monitored or is at risk of being monitored by the state or another organization, you really want to spend some time with this. And I'd encourage you to really be thinking about it before that client is in the room. Okay. So wrapping up here, getting to the point where I'd like to wrap up. I think there's some particularly interesting disclosure policies in HIPAA that would be of interest to folks through Frontline. HIPAA, again, so being the federal policy, only requires disclosure of protected health information without authorization in a couple of circumstances. So they require you to disclose records, to provide records to that person, that patient, or their legal guardian. And then they also require you to comply with compliance investigations through Health and Human Services. And then HIPAA would dictate that you're permitted to disclose other things, but that would be where you might want to look into your state laws and policies, because what the federal government permits, your state law might require disclosure around. So some of the particularly relevant areas where disclosure might be permitted would be in terms of kind of to any payment source. Some folks get really uncomfortable about what may or may not be disclosed to their health insurance. Maybe they're a minor and they're worried about what their parents will see on their as the person who pays for their health insurance. You'll want to have an understanding of that. And a big category that I want to talk about is disclosures that are permitted for the purpose of the public interest or benefit. So this would include some of the big heavy hitters, including duty to protect policies or duty to warn, mandates to report child abuse, potentially animal abuse, in the public health emergency, something like that. And I hope that this is not new information to any healthcare provider. I know as social workers, we really get it drilled into our head about kind of mandated reporting and the ways to manage that. But there's still some of the most common ethics questions that I get at NASW. Something that has come up too is disclosure to law enforcement. So it's in the interest of kind of public protection. If a client of yours has expressed an intention to commit an act of violence, there are likely some policies that you'll have to follow through your state law that you'd want to be familiar with that would require you to take action to protect that person. And that might involve disclosing to law enforcement the nature of that threat with or without the authorization and permission of your client. HIPAA does have Health and Human Services does have a good FAQ about when a law enforcement officer what they would have to have in place to request records from you. That I'd recommend everybody take a look at if that might be relevant to your work. There are some situations when you might be required to disclose and to share records with a law enforcement officer, but of course that's not kind of carte blanche. You're not expected to ever pull out a full case summary that includes all of the details of your patient's life and their assessment and diagnosis, etc., just because a police officer might ask you. But there are circumstances and processes that a law enforcement representative might go through and have a legitimate request and enforceable request to your records without the authorization of your client or patient. So I'd love for everybody who's listening to this to be aware of your responsibilities there and have thought through your response based on the folks that you work with, particularly folks who might be under surveillance by law enforcement officers or find themselves kind of being more in touch with our criminal justice system. There are also multiple kinds of subpoenas that you should be aware of. Not all subpoenas require you to disclose your records right away. So I know social workers, social workers and many other healthcare professionals do have patient-client or patient-provider privilege that's expected. So claiming privilege prior to disclosing any records is an expectation that social workers first act to protect your client's health information, even if it's at the request of a judge or someone like that. So I'd really encourage everyone to become really familiar with the expectations of you in your specific practice setting in your state. And that really gets me to the end of my prepared discussion points. Lisha, do you have any questions for me?
So we haven't had any questions come up on the question tool. If anybody is watching live and has questions, you can go to https://goo.gl/UHF as in Frank EHV. I've put that up a couple of times on the screen, so hopefully you've been able to see it in the video. I've also put it in the chat that's on the live viewers window, so hopefully it's in enough places. That URL again, it's goo.gl/slides/unicorn hotel Foxtrot Echo Hotel Victory. I can't remember what V is, but so if you have any questions, please go ahead and put them in there. And I'm scooting around to check to see if anybody has put anything in the chat, and nobody has. So no questions yet. If you happen to be watching this video not live, you're watching the recorded video on YouTube later, you can put questions in the comments on the video, and we will get them back to Colleen, and hopefully she'll be able to answer them for you after the fact.
Sounds good.
So in the next 10 minutes or so, I'd like to talk to you a little bit about some thoughts beyond just the issues that HIPAA requires of you. So at Frontline Wellness United, we work with activists. That is our main purpose, is to support people who are engaged in nonviolent conflict and civil resistance. And as I'm sure you are already aware, people that are involved in this type of activism are often targeted by both governmental agencies, law enforcement, or some other agency, and also by private interests. As an example, the water protector camps in Pennsylvania, in Florida, you name it, all the places where there have been the water protectors have not only had to be concerned about law enforcement, but also private security companies like Tiger Swan, who are not bound by the same rules that law enforcement are bound by, and they seem to not actually care about the rules that they are supposed to be bound by at all. So they engage in a lot of nastiness to get information about the people that they are tagging. I bring that up because one of the things that we found at Standing Rock was that healthcare providers, especially mental health care providers, it's so that malware could be put on their phones, devices would suddenly show up again, right where they left them, you know, right at the top of their bag after it had disappeared for 2 days. And we believe that the reason is that if you know that people are going to all their secrets to somebody like a mental health professional, and you want to get all the secrets, then the best thing to do is to record what people are saying around the mental health care provider. So something similar also happened in Puerto Rico after Hurricane Maria. I got a woman and had been recruited to provide healthcare services in Puerto Rico. Well, she got over working with an NGO that was working tightly with the U.S. government, and she found actually using the mental health care providers to gather information about what's going on the ground, because they were concerned about uprisings, basically, in the aftermath of the hurricane. And they saw any sort of activism or sounds of civil resistance potentially dangerous. So we know that healthcare providers, and especially mental health care providers, can be used against people resistance and activists of all sorts, and they against whistleblowers. Now in the current in the United States and probably elsewhere as well, we have to be concerned as well about how their healthcare providers might be used against immigrants, especially people who at higher risk of so when somebody comes to you and they seem very about what they say in your office getting out, this is not a reason to diagnose them with something pathological. It is paranoia to be concerned that what they say to you, even if you have every intention of keeping this private, might get out. So there are a number of talks you can find. I'm going to post a few in the show notes after this is over. A number of talks for hackers and computer security professionals about how to find good mental health care and work in to go watch one or two of those to get an idea of what the concerns from the cybersecurity side of things are. Our concerns are going to be very similar to the concerns of other vulnerable populations that you may deal with. And not only is it the things that you're probably used to hearing at this point, that, you know, people don't necessarily want you to take notes. They may specifically ask you not to bill their insurance, but rather to let them pay cash if they're able to do that. But if I were going into an office, I would ask to make sure that there were no connected devices in the room at all. I would not like to have your telephone in the room with me. I don't want your computer to be in the room with me. I certainly don't want an Alexa in the room with me. And so why is this? Why would I care about this? So you already know your phone probably has Siri on it or OK Google. And you may have already set your OK Google or your Siri so that it doesn't listen to you all the time, or at least we assume it doesn't listen to you all the time. But do I really trust it? I don't know for sure that there isn't malware on your phone to make it record all the time. And I don't know who has control of that malware. Even if it is not a a governmental agency that has put malware on your phone that is recording, the chance that there's something on your phone that is recording at all times, whether it's by the company that your phone comes from, Apple or Google, or whether it's by some other source, the chances that that information could get to somebody that I don't want it to are too high. I think of this like an analogy would be when you're telling teenagers not to sext with each other. Yes, sure, I know you want to send your boyfriend that picture, that sexy picture, but what is your boyfriend going to do with that? Or I'm sure you want to send your girlfriend that sexy picture, but when she's not friends with you anymore, what is she going to do with that? It's not that you do or do not trust the person that you're dealing with right this minute, but you don't know what's going to happen in the future. Obviously, when I give you that example, you're probably sitting there going, oh yeah, oh my gosh, why would anybody do that? Well, it's the same thing. Why would anybody, especially somebody who's, vulnerable in the first place, talk openly around devices that may or may not be recording them? So before anybody asks you to get rid of all of the potentially recording devices in your office, it would be a good idea for you to go and look at what do you have in your office and can you disconnect these things from the internet completely. Okay, so you have a laptop or you have a computer in your office. Can you disconnect it from the internet? Will you be able to do your work with that machine completely disconnected from the internet? If you can't disconnect it from the internet, what can you do to make sure that it is not recording? Can you make sure that there are no internal microphones that are connected so that you have to intentionally plug in an external microphone? So that if you have somebody who is concerned about these sorts of things, you can say, yes, I have a computer, it is connected to the internet, but it has no microphones connected to it at all. I have to plug in a microphone to even be able to have a video conference call with somebody. Your telephone, you probably keep your telephone with you all of the time. There are a few things that you can do to make sure that there's privacy. You can have a Faraday bag like this one. These bags are used by forensics specialists. If I want to take a phone that I know has malware on it, and I want to make sure that the bad guys who put the malware on the phone can't take the malware off before I have a chance to look at the phone, I'll put the phone in one of these bags, and then I can get the bag to a safe place that, is completely enclosed in a Faraday cage, and I can look at what's on the phone. But you can use a bag like this to make sure that while you're sitting in a session with one of your patients, with one of your clients, that nothing that they say is going to be recorded and sent through the airwaves. You can also make a very cheap Faraday cage with one of those cookie tins. Take your phone or your other small device, wrap it in cloth, then stick it in a plastic Ziploc baggie and stick it inside your cookie tin. And you have a pretty good Faraday cage to protect your patients from having their conversations recorded. Remember also that the cloud is somebody else's computer. So if you're taking notes and saving them up to Google or saving them up to some other service provider that their servers are out there somewhere, you are saving your patient's information on somebody else's computer. If it is 100% encrypted and you're the only one that has the keys, that's lovely. That means that in order for them to get at that information, they'd have to get the keys from you. But if it's sitting there, even if it's encrypted, but the other provider has access to the keys, that means that there's one other location that could be subpoenaed or just asked. The government can come and just ask, hey, can we have all this data? And historically speaking, and by history, I mean in the last 10 years, more than once, companies have handed information over, not because there was any court order or a subpoena, but just because somebody asked. So keep that in mind, and make sure that you are protecting the data that you have of your patients and clients. So we are now at 50 minutes after the hour, and I need to get ready for the next workshop in another 10 minutes. The Board of Directors of Frontline Wellness United is going to be talking about our goals for the future. So I hope that you will click over and watch that with us. The link to that video is in the show notes for this show. So I look forward to seeing you over there. I'm going to really quickly just double check. Oh, hold on. Before we go, let me share the screen. Hold on. Share my screen. And hopefully we'll be able to, hopefully everybody will be able to see this. So the first question, which I hope you can see, do you have to report an expressed desire to harm others, or only if there's a plan or an intention? Colleen, I believe that's for you.
Yeah, tricky. Not something I'll be able to answer thoroughly, probably based on the question. But what you'll want to look up based on your state in Ohio, that we have a pretty thorough protection called under the kind of the heading duty to protect, and that'll spell out pretty explicitly your requirements, and there is going to be a level of discretion probably written into or I should say a level of ambiguity written into the law. I believe in Ohio, the term, don't quote me, might be serious threat. Someone makes a serious threat. So reasonable people could disagree on lots of the language, but you'd want to look at case, precedent. I recently sat through a 2-hour training on the duty to protect law just in Ohio, and just for social workers. And we all left that training with more questions than answers. So tricky, certainly. I think that you've outlined the levels of kind of thoughts versus intent versus plan being levels to consider when you're assessing anybody, whether it's for risk of suicidality or for of violence toward others, and certainly how you'd want to document that in your case notes. But this is a tricky question, and reasonable people disagree.
All right, and the second question is, what's the issue with sharing info with Alexa? So, in case I didn't make it clear, any information that is recorded by Alexa or by OK Google or any of your other voice-activated computer tools, that is sitting on somebody else's computer. And those people can sell that information. They can give that information because of a subpoena or because of a request. These days, actually, selling the information is a real concern. So there are a number of things that the government is not allowed to get information from phone companies, for instance. There's certain types of information that they can't force the phone company to hand over, but they've gotten around the rules by purchasing the information from phone companies in the same way that other companies are purchasing that information from the phone companies, because the data about phone calls is a piece of data about you that there are people who, or rather companies, who would like to buy that information. So it's for sale and the government buys it. Police departments buy it. So in the same way as that's happening, if your voice is recorded by Alexa and all of your voice recordings are for sale in some form or fashion, whether today or in the future, then it's not only companies that could purchase that, but also law enforcement could purchase that. And they could be purchasing it because they're targeting you in particular. And then, of course, there's always if it's recorded, if it's existing on a computer someplace, that computer could be taken as part of a warrant, or as, specific data can be subpoenaed, or it could just be requested and a company hands it over for whichever reason. And once those recordings are on somebody else's computer, like it or not, you've lost control of it. I'm not sure if Alexa, if Amazon allows you to see all of the recordings of your voice, but it is possible to see all of the recordings on your Google account. So, for instance, on my phone, I have OK Google turned off, but I still sometimes press the button to be able to record myself and say some things, ask my phone to do something using my voice, or I use the voice for voice typing when I press the button. So all of the recordings from every time I've ever pressed the button, those are all available in my Google account settings. In the privacy settings, you can find all of those recordings. I'll put a link to that as well. So with Google, I can see what has been recorded, or at least what they're willing to tell me they've recorded. But there are lots of things that make you kind of go, this is odd. I was just speaking about such and such a thing in front of my telephone, and then I start getting ads for that thing I was just talking about that I didn't type anywhere. Supposedly, my recording is turned off. If I look at the recordings, I don't see any hints that they have recorded me talking about this thing. And yet somehow right after I talked about it in front of my phone, I'm getting ads. So there's still questions that any reasonable person would have about whether our devices are listening to us at times when they even claim that they're not listening to us. So that is the main issue with sharing info with Alexa. All right, so I now have 4 minutes to get ready for the next meeting. So I'm gonna thank you all very much for coming and taking part, and I look forward to seeing you over at the next call in 3 minutes now. I'll see you there.
Thanks, Lisha.
Thank you, Colleen.